Good morning. So I'm actually starting a little bit late because I have to do things a little bit scrappy this morning. I hope that my microphone is good. But I'm here getting my coffee and, I'm off site. So I didn't get to do my beauty ritual yet, but I got to get in this reading. So I'm going to get right into section 4. And let's get to it. So, Section 4, the 10 steps to successful breastfeeding for hospitals and birth centers. The 10 steps to successful breastfeeding, first published by the World Health Organization and UNICEF in 1989, formed the basis for the UNICEF WHO Baby Friendly Hospital Initiative, BFHI, which was inaugurated in 1991. These original 10 steps appear in Box 4.1. So the next page. In 2018, WHO and UNICEF published revised BFHI implementation guidance, in which the original 10 steps were updated and reorganized into 2 sections, separating management and policy procedures from clinical care practices. And that's in box 4.2, and that's on the next page. The BFI encourages hospitals and birth facilities to develop policies and implement practices that support parents in learning appropriate, responsive infant feeding. National BFHI authorities recognize hospitals and birthing centers when they have fully implemented the 10 steps to successful breastfeeding, while WHO and UNICEF have updated the 10 steps. National authorities determine the process of adopting such updates. Readers should check with their national authority about adoption of the global standards. Receiving the baby-friendly designation requires an on-site survey by a baby-friendly assessment team after the hospital or birth facility and the national authority indicate readiness for assessment. In many countries, a subsequent blinded external review of the assessment findings is required prior to the final determination about awarding the baby-friendly designation. The following is a brief over. Actually, I'm going to pause there, and I'm going to go back and read these tables that are on the page. I will pause this to say, listening to this is not a substitute for getting the book. You actually really do need the book so that you can understand things in context. And then when you are taking the your assessments, your actual live assessments, part of it you'll have is open book, and so you'll need to reference the book. So you really do need to actually get the book in order to not only for your own self, but also to actually do your parts of the exam and assessments. So box 4.1. The original 10 steps to successful breastfeeding, World Health Organization and UNICEF, 1989. 1. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. 2. Train all healthcare staff in the skills necessary to implement this policy. 3. Inform all pregnant women about the benefits and management of breastfeeding. 4. Help mothers initiate breastfeeding within a half hour of birth. 5. Show mothers how to breastfeed and how to maintain lactation, even if they should be separated from their infants. 6. Newborn infants no food or drink other than breast milk, usually medically indicated. 7. Practice rooming in, allow mothers and infants to remain together 24 hours a day. 8. Encourage breastfeeding on demand. 9. Give no pacifiers or artificial nipples, also called dummies or soothers, to breastfeeding infants. 10. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. And then this says, there's a caption that is reproduced from the World Health Organization 2018. I will say about these breastfeeding policies, I've been in Newark University Hospital and I don't see that posted anywhere. Babies are routinely stripped from their mothers. I think that Newark University Hospital is supposed to be a baby-friendly, designated baby-friendly. They're baby-friendly on paper, but not in practice, because the medical practitioners there are not practicing what's on the paper, and definitely not talking about or initiating breastfeeding. Definitely taking the babies immediately away Um, so I look at these, when something is designated baby friendly, I look at it skeptically because I know in practice that it's not always what's happening. Box 4.2, so this is the other page. Box 2, 10 Steps to Successful Breastfeeding, revised 2018. First step is critical management procedures. 1A, comply fully with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly resolutions. B, have a written infant feeding policy that is routinely communicated to staff and parents. 1C, establish ongoing monitoring and data management systems. 2, ensure that staff have sufficient knowledge, confidence, and skills to support breastfeeding. Key clinical practices. 3, discuss the importance and management of breastfeeding with pregnant women and their families. 4, facilitate immediate and uninterrupted skin-to-skin contact and support mothers to initiate breastfeeding as soon as possible after birth. 5, support mothers to initiate and maintain breastfeeding and manage common difficulties. 6, do not provide breastfed newborns any food or fluids other than breast milk unless medically indicated. That's very tricky because medically indicated, if you are a mom that is in labor and you are hounded by medical professionals telling you what they know best, and you may not be confident in what you feel is appropriate for your child, it's intimidating to be surrounded by medical professionals that are saying what they think is best. And I've been a nurse for 30 years, and I've been a doctor. I've been doing this a long time. You don't want to do this, and you don't want to do that. And are you sure that's right? I'm the professional, and it really makes a lot of families question their ability to make decisions. It's really intimidating. They have so many tactics, and it's kind of harmful to families that are trying to make the best decision for their baby. So medically indicated, yes, there are medically indicated reasons why a baby may need to have breast milk, but having an advocate there with the family to make sure that the family is able to question why and to give other options is really, really important. Number 7 is enable mothers and their infants to remain together and to practice rooming in 24 hours a day. So now going back to the regular reading. Oh wait, I'm sorry. There's still more. In the 10 steps. Number 8, support mothers to recognize and respond to their infants' cues for feeding. 9, counsel mothers on the use and risks of feeding bottles, teats, and pacifiers. 10, coordinate discharge so that parents and their infants have timely access to ongoing support and care. And we know as community doulas this is very critical, but it's not always available for our families. So now I'm going back to the reading from the charts. The following is a brief overview of the purpose and global standards for each of the revised 10 steps. Steps and evaluation standards are provided as direct quotes from the current implementation guidance, World Health Organization and UNICEF 2018. For further detail about guidelines and criteria for implementation, consult the WHO UNICEF International Full Document as well as guidelines from the pertinent national authority. Critical management procedures. Step 1A. Comply fully with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly resolutions. Okay, so now this part of the book is going over the chart. So there's a chart here of these 10 steps, and now seems to be going over each of these steps in detail. Purpose: to protect families from the influence of companies that manufacture breast milk substitutes, bottles, and teats or nipples. Background: the International Code of Marketing and Breast Milk Substitutes, the Code, was adopted by the World Health Assembly in 1981 as a piece of model legislation intended to be implemented internationally. Unfortunately, as of this date, the Code is not currently enforced in all nations. See Appendix T for more information. Regardless of the national status of code legislation, this step requires implementation of those aspects of the code that fall within the facility's purview. Global standards. All infant formula, feeding bottles, and teats used in the facility have been purchased through normal procurement channels and not received through free or subsidized supplies. The facility has no display of products covered under the code or items with logos of companies that produce breast milk substitutes, feeding bottles and teats, or names of products covered under the code. The facility has a policy that describes how it abides by the code, including procurement of breast milk substitutes, not accepting support or gifts from producers or distributors of products covered by the code, and not giving samples of breast milk substitutes, feeding bottles, or teats to mothers. At least 80% of health professionals who provide antenatal, delivery, and or newborn care can explain at least two elements of the code. And this is reproduced from the World Health Organization and UNICEF 2018, page 12. Step 1B, have a written infant feeding policy that is routinely communicated to staff and parents. 1 second. Just need to send a text message. Okay, step 1B, have a written infant feeding policy that is routinely communicated to staff and parents. Purpose, ensure the existence of evidence-based policy that promotes breastfeeding and delineates standards of care. Global standards. The health facility has a written infant feeding policy that addresses the implementation of all 8 key clinical practices of the 10 steps, code implementation, and regular competency assessment. Observations in the facility confirm that a summary of the policy is visible to pregnant women, mothers, and their families. A review of all clinical protocols or standards related to breastfeeding and infant feeding used by the maternity services indicates that they are in line with BFHI standards and current evidence-based guidelines. At least 80% of clinical staff who provide antenatal, delivery, and or newborn care can explain at least 2 elements of the infant feeding policy that influence their role in the facility. Step 1C, establish ongoing monitoring and data management systems. To ensure that the implementation of clinical practice support breastfeeding and related maternity care practice is tracked and monitored routinely. Here's the thing about working in our communities. Clinicians are very good at monitoring and data management and tracking. They're very good at that. They will track you to death. They track these families to death. They monitor them to death. But is it for the benefit of families? Are families being heard, and are the best services offered to these families while he's tracking? I think that is, I highly doubt that. Instead, this is another way of surveillance on these families that actually ends up harming them. In my experience, it harms the families. It's not actually helping them. So what I advocate for is that these systems are used to advance medicine in a way that is positive experience for these families, and not using it as another mechanism for tracking families in a harmful way that can cause them to be punished, used as a punitive measure. So, we look at all these 10 steps. I feel like out of all the 10 steps, clinicians, they love to track. Even during birth, man, every 30 minutes, every 20 minutes coming in to track. The family is trying to relax. The laboring person is trying to relax and get into the groove, or they're trying to get to know their baby. And then, boom, a clinician comes in and totally distracts and interrupts to track. And it's really hard for a family to kind of get into a good zone, a positive zone where there's less anxiety, and so they could focus on the laboring, or they can focus on getting connected with the baby. It's really challenging. So I think that the clinicians have the whole tracking and monitoring down pat, and whether it's being positively enhancing the family, that's questionable to me. So, the global guidance identifies specific indicators for each of the key clinical practices, steps 3 to 10, including indicator definitions, targets, and data sources. It is expected that the facility has a protocol for ongoing monitoring and data management system to comply with the 8 key clinical practices. Clinical staff at the facility meet at least every 6 months to review implementation of the system. Step 2, ensure that staff have sufficient knowledge, competence, and skills to support breastfeeding. Purpose, ensure that all staff have received training necessary to develop effective skill in supporting breastfeeding families, providing consistent messaging, and implement facility policies. Another note on that. So, in Black and Brown communities, we know that the messaging for breastfeeding is not high. They're not really advocating and promoting breastfeeding as much in these communities, and so therefore our families are less likely to breastfeed. It could be that the clinicians are not fully versed in breastfeeding, and so that's why they are not advocating as much. Or there could be a stigma against breastfeeding. There's so many different indicators or reasons why Black and Brown communities, there's less breastfeeding happening there. But it can start with staff as advocacy for breastfeeding. Global standards, at least 80% of health professionals who provide antenatal, delivery, and or newborn care report they have received pre-service or in-service training on breastfeeding during the previous 2 years. At least 80% of health professionals who provide antenatal, delivery, and or newborn care report receiving competency assessments in breastfeeding in the previous 2 years. At least 80% of health professionals who provide antenatal, delivery, and or newborn care are able to correctly answer 3 out of 4 questions on breastfeeding knowledge and skills to support breastfeeding. Key clinical practices. Step 3, discuss the importance and management of breastfeeding with pregnant women and their families. Purpose, ensure the integration of messages about breastfeeding in prenatal education interchanges. Global standards. A protocol for antenatal discussion of breastfeeding includes, at a minimum, the importance of breastfeeding, the global recommendations on exclusive breastfeeding for the first 6 months, the risk of giving formula or other breast milk substitutes, and the fact that breastfeeding continues to be important after 6 months when other foods are given, the importance of immediate and sustained skin-to-skin contact, the importance of early initiation of breastfeeding, the importance of rooming in, the basics of good positioning and attachment, recognition of feeding cues. At least 80% of mothers who receive prenatal care at the facility report having received prenatal counseling on breastfeeding. At least 80% of mothers who receive prenatal care at the facility are able to adequately describe what was discussed about 2 of the topics mentioned above. Step 4, facilitate immediate and uninterrupted skin-to-skin contact and support mothers to initiate breastfeeding as soon as possible after birth. Purpose, ensure the early initiation of skin-to-skin contact for all infants, whether or not there is an intention to breastfeed, and support the early initiation of breastfeeding when intended. Global standards. At least 80% of mothers of term infants report that their babies were placed in skin-to-skin contact with them immediately or within 5 minutes after birth, and that this contact lasted 1 hour or more unless there were documented medically justifiable reasons for delayed contact. Here's another one. A lot of times in hospitals, there's always some medical reason why the baby has to be taken away. So it's like, who gets to say what is medically justifiable? If it's every single birth that I've gone to, or most births that I've gone to, there's always a medically justifiable reason to take the baby away. it must mean that like the babies who can be kept with their moms, they must be unicorns, right? Like, why is every single baby, there's always a medical reason why they need to be taken away? Why they can't have immediate skin to skin? There's something that's not adding up here. So, at least 80% of mothers of term infants report that their babies were put to the breast within 1 hour after birth, unless there were documented medically justifiable reasons. So keep in mind, when I'm reading, those are the standards. And so in order to meet the standards, at least 80% need to report that. I don't think that that's happening. Step 5, support mothers to initiate and maintain breastfeeding and manage common difficulties. Purpose, ensure ongoing breastfeeding support, assessment, and evaluation throughout the maternity stay. This step pertains to term, preterm, and sick newborns. Global standards. At least 80% of breastfeeding mothers of term infants report that someone on the staff offered assistance with breastfeeding within 6 hours after birth. At least 80% of mothers of preterm or sick infants report having been helped to express milk within 1 to 2 hours after birth. At least 80% of breastfeeding mothers of term infants are able to demonstrate how to position their baby for breastfeeding and that the baby can suckle and transfer milk. At least 80% of breastfeeding mothers of term infants can describe at least 2 ways to facilitate milk production for their infants. At least 80% of breastfeeding mothers of term infants can describe at least 2 indicators of whether a breastfed baby consumes adequate milk. At least 80% of mothers of breastfed preterm and term infants can correctly demonstrate or describe how to express breast milk. Step 6. Do not provide breastfed newborns any food or fluids other than breast milk unless medically indicated. Purpose, ensure that healthy breastfeeding babies are not routinely supplemented with any food or drink other than human milk unless medical indications exist for supplementation. Global standards. At least 80% of infants, preterm and term, receive only breast milk, either from their own mother or from a human milk bank, throughout their stay at the facility. At least 80% of mothers who have decided not to breastfeed report that the staff discussed with them the various feeding options and helped them to decide what was suitable in their situations. At least 80% of mothers who have decided not to breastfeed report that the staff discussed with them the safe preparation, feeding, and storage of breast milk substitutes. At least 80% of term breastfed babies who receive supplemental feeds have a documented medical indication for supplementation in their medical record. At least 80% of preterm babies and other vulnerable newborns that cannot be fed their mother's own milk are fed with donor human milk. At least 80% of mothers with babies in special care report that they have been offered help to start lactogenesis 2, beginning plentiful milk secretion, and to keep up the supply within 1 to 2 hours after their baby's birth. Step 7. Enable mothers and their infants to remain together and to practice rooming in 24 hours a day. Purpose. Ensure that healthy mothers and babies have ample opportunities for skin-to-skin contact, and ensure that mothers achieve early learning of the baby's feeding cues. Global standards. At least 80% of mothers of term infants report that their baby stayed with them since birth, without separation lasting more than 1 hour. Observations in the postpartum wards and well baby observation areas confirm that at least 80% of mothers and babies are together or, if not, have medically justifiable reasons for being separated. At least 80% of mothers of preterm infants confirmed that they were encouraged to stay close to their infants day and night. Step 8. Support mothers to recognize and respond to their infants' cues for feeding. Purpose. Ensure that mothers are encouraged to feed their babies in response to the baby's signs of feeding readiness. Global standards. At least 80% of breastfeeding mothers of term infants can describe at least 2 feeding cues. At least 80% of breastfeeding mothers of term infants report that they have been advised to feed their babies as often and for as long as the infant wants. Step 9. Counsel mothers on the use and risk of feeding bottles, teats, and pacifiers. Ensure that breastfeed babies are not deterred from learning how to suckle at the breast and thereby from maximizing milk production. Global criteria. At least 80% of breastfeeding mothers of preterm and term infants report that they have been taught about the risks of using feeding bottles, teats, and pacifiers. Step 7. Coordinate discharge so that parents and their infants have timely access to ongoing support and care. And this is critical. This is the postpartum period that a lot of families don't have. I could do a whole segment on this whole, especially in America, in the American culture, this rugged individualism and, this whole pull yourself up by your bootstraps and this whole nuclear family from like the 1950s. Actually, that's not how babies and families thrive. And that actually has screwed us all up. When you look at other communities, other cultural communities, where they focus on the extended family and communal living and community raising of families and babies, those babies actually thrive. And even in America, when those communities still stick together, in a lot of Hispanic communities, Latino communities, their babies are thriving because they maintain that type of culture where it's community culture, and that there is that ongoing support past the birth from the extended family. Whereas the American culture has it all screwed up, where it's like, okay, well, you had a baby, you're supposed to be able to do it all on your own. You're supposed to raise your baby on your own and be an adult and be all these things and do it all by yourself, and that ensures success. And actually, data and studies are showing that is actually harming families, and that's harming the success of healthy babies. And so the ongoing support, the postpartum support, is critical for families. We need to divorce and get rid of this idea of the nuclear family and doing it all on our own. That is not healthy. So, going back to that step 10, coordinate discharge so that parents and their infants have timely access to ongoing support and care. Purpose, ensure that mothers are linked to ongoing breastfeeding support resources. Global criteria. At least 80% of mothers of preterm and term infants report that a staff member has informed them where they can access breastfeeding support in their community. The facility can demonstrate that it coordinates with community services that provide breastfeeding infant feeding support, include clinical management and mother-to-mother support. And all this was reproduced from the World Health Organization, UNICEF, 2018, all of these standards. So that, my friends, completes section 4. I'm going to come back and try to see, I think section 5 is relatively short, so maybe I will do this evening. Section 6 is a beast, so I feel like that one we're going to need an hour or maybe longer to get through that one, because that one's pretty long. Section 5 is probably going to be maybe 15 minutes or so. But I am going to get ready for work, get ready for the day. Thank you for coming and listening and studying with me. And I will see you later for section 5. Bye.